Hi, Mike Gibson and Sheila Sahni coming to you live from SCAI 2016. Well, Sheila, we need more young people in interventional cardiology, and we also need more women in interventional cardiology. I'm so happy to see that you're going to be joining our ranks. Talk to us a little bit about why you, as a young woman, decided to go into interventional cardiology, and how can we encourage more young people, and women in particular, to enter our field?
Well, I think to be interested in interventional cardiology, you have to begin with being interested in cardiology. And that really starts with doing what you love and finding a good mentor that won't let you second guess yourself. Cardiology is a demanding field, but that should not preclude women just because of the burdens of other concerns with work-life balance, that they can't pursue their dreams.
Absolutely.
And I think that that's often what happens. Women start to think, no, I can't fit in that role if I want these other things. So when you can pursue what you love in science, then you can allow yourself to kind of look into the subspecialties of cardiology. And I think women tend to go into imaging, and even more often now they're going into heart failure as a really good imaging hybrid. And you don't see women going into interventional because you hear the burden of STEMI call.
Right, and they view it as an easier lifestyle choice to go into imaging. But I've known plenty of women in interventional cardiology, people like Cindy Grimes. I mean, Cindy, you know, for decades took call and did STEMI cases. She's a mother, she has a couple of kids.
Absolutely.
You know.
And at Mount Sinai, I was where I did my residency, I was often very inspired by Dr. Annapurna Kinney, who's also a mother, as well as Dr. Roxana Meran, who's not only a mother, but also a real leader in the field, as is Dr. Kinney. When I came to UCLA for my cardiology training, I was really inspired by how many women are on academic faculty, and we have 2 full-time females in the interventional group. And that's been really amazing, but they're not my only mentors. And when I went to decide to go into interventional cardiology, I approached Dr. Jonathan Tobis.
Sure.
And he told me, Sheila, it's no big deal. You need a supportive husband and a full-time nanny. And I think that that's the kind of things that women need to hear. That if we love it, we can do it, we can make it work.
Yeah, you have to build your life a little bit around it, but it's very doable.
Right, if you want that. I mean, not everybody wants that,
Sure.
but if you do, you just need to kind of choose how you're going to support yourself as you would anything.
Right.
I think organizations like the SCAI Women in Innovations is absolutely amazing. Not only is it advocating for women to go into the field, but it's promoting women to do research for women who are suffering from this disease.
Sure.
That platform of education, patient care, and research is really powerful and allows, for instance, I'm finishing my general cardiology fellowship and I'm here on a SCAI-Win scholarship, and I'm going to be presenting a case amongst this platform, but I've been following them at TCT, at CRF, you know, and just kind of watching this group and using them as a networking support system.
Now, you're younger, you use social media. Why aren't more people in cardiology using social media?
That's a really great question, and you, as top influencers in our umbrella of internal medicine, you are one of the most influential cardiologists in social media. I think not enough people know about it.
Right.
I learned about it through my involvement at the American College of Cardiology and the Advocacy Board. And I thought that it would be great to advocate for my patients on a preventative platform.
Right.
As I started to attend more interventional meetings, I realized it's a much faster way to get the buzz out.
Right.
I think the more and more we start to create a thunderclap, as we did at ACC, more smaller groups, heart failure, as well as interventional and structural, will start to take it on. It's the next generation.
Absolutely.
Our patients now, their children, as we continue to grow, as we continue to take care of them, will be asking about it.
Right.
And doctors need to own their presence in social media.
Well, they come to you with their iPhone and they say, look, this is what I read and this is what I'm seeing. You know, you're almost giving them a second opinion, you know, at this point. So we may not like it, but it's a world that we have to adopt to, right? Great. Well, Sheila, I feel like we're in good hands in the future, seeing young people like you at the meetings. So thanks for joining us here.
Thank you. Thank you for having me.
Thanks for picking interventional cardiology. And thanks to all of you out there for joining us here live from SCAI 2016.